Yep, Jim's got a prayer. I will remember.
Okay.
Yeah.
Prayer today is, may the Lord show us the greatness of His goodness, that you overflow with thanks every day. May the Lord bless you abundantly with rest for the heart, power for virtue, wisdom for life, and patience in suffering. May the Lord bless you with joyful hope, and one day with the inexpressible joys of eternal life. Amen.
Amen. Thank you, Jim. Okay, open the meeting here at 9:11. The Commissioner's Office is requesting the Board approve and execute the minutes for the meeting of July 14th, 2020. A motion, please.
So moved.
Second?
Commissioner DeWark?
Yes.
Commissioner Spillier?
Aye.
Commissioner Lennon?
Aye. And then the Commissioner's Office requesting the Board approve and execute the minutes for the meeting of July 21st, 2020.
So moved.
Second?
Commissioner DeWark?
Yes.
Commissioner Spillier?
Aye.
Commissioner Lennon?
Yes. Okay. And Adrian.
Morning, Commissioners.
Good morning.
So today's financials include an appropriations transfer from the Commissioner's contingency account to municipal court criminal prosecution account to pay for an increase in indigent defendants requiring representation. There's cash transfers from the Coronavirus Relief Fund to various departments to reimburse them for unbudgeted expenses incurred as a result of the pandemic, in accordance with Resolution of Acceptance 20-087. Among the encumbrances are purchase orders for maintenance to Nevrid Limited for window washing at various county buildings in the jail. Among the vouchers is $39,480 from the Commissioner's Office to the Lake Geauga Recovery Centers for the county's share of an assistant to the jail treatment program. And finally, revenue certifications from the public defender, recorder, sheriff, and treasurer for additional unbudgeted revenues received by the general fund in 2020.
Okay. Thank you. Okay, any questions, comments on the financials? A motion to approve?
So moved.
Second?
Commissioner DeWark?
Yes.
Commissioner Spillier?
Aye.
Commissioner Lennon?
Yes. Okay. And then the CARES Act expenditures, you're going to talk
Yes.
about that? Okay.
So this next one is going to be Resolution 20-093. It's a resolution of acceptance for and approval of CARES Act expenditures. And the total for this round is $33,492.52. For reimbursement, it's $11,206.56, and that's $1,748.55 for aging, for mobile phones, phone cards, webcams, ink for printing, mileage reimbursements, and for home delivered meal workers. $5,595.19 for ADP for remote working, which includes webcams, monitor adapters, speakers, WebEx license, Wi-Fi adapters, cables, and hotspots for phones. And $3,862.82 for prosecutor, which includes PPE, sanitation, thermometers, laptop computers with accessories, wall-mounted, large screen television for teleconferencing.
Good. And how many, how many rounds will we do?
We'll probably be doing this every week
Every
until,
week?
yeah, probably middle of December.
So, or is it October? Isn't there a deadline?
October is the deadline for encumbrance.
Oh, okay.
It has to be expended by December.
Gotcha.
And then there's $22,285.96 being proposed, and that's $13,830.08 for the prosecutor. This includes a forensic laptop, 3 cameras, 1 desktop, 1 laptop computer for remote working and replacing 19 cloth chairs, and $8,455.88 for the building department, which includes remote working, 6 laptops with accessories.
Okay. Very good. All right. So if we could have a motion to approve resolution number 20-93.
So moved.
Second?
Commissioner DeWark?
Yes.
Commissioner Spillier?
Aye.
Commissioner Lennon?
Aye.
Okay, we have to move number 14 up. I moved the wrong one up, Adrian.
Oh, I'm sorry.
Okay.
In the confusion of everything that was going on this morning, I moved the wrong one.
Yeah.
So 14 is supposed to be moved up, not 5.
So I'm standing in for Joanna on this one. The Transit Department is requesting the board approve and grant a waiver to the policy prohibiting the payment of late fees and finance charges, and to allow a payment to Dominion East Ohio Gas in the amount of $22.81 due to an error caused by a previous employee. As you know, transit had a rough year last year with the passing away of the director and the retiring of two very high-level, longtime employees. I think this particular bill just kind of got away from them, and Dominion, my experience with them is that they're kind of difficult to work with to try and get some of these things resolved. We've been trying now for months to try and get them to forgive these late fees. I think their standard policy is like one time a year, and I think we probably already used that, so they've been refusing to pay these. And the financial-minded people tend to not to like to leave a balance on these things, so we'd like to get that resolved so that they can move on.
Okay,
This is a one-time waiver.
sure. Okay, motion, please?
So moved.
Second?
Commissioner DeWark?
Yes.
Commissioner Spillier?
Aye.
Commissioner Lennon?
Yes. Okay, great, thanks, Adrian,
Thank you.
appreciate it.
Five, we go back. We're 14.
Okay, so we have archives and records?
Nope, we're
No.
gonna move that one down.
Oh,
We're swapping 14 and 5.
okay.
So it's Mr. Clay.
Oh, good.
Hey, Tom.
Okay, excellent. Number 6, Tom Craig will provide us a update.
Yeah.
How you doing today?
I'm good.
Good, good.
I did bring some handouts, because I thought, cut data, hopefully it's good to have some visuals as well.
Absolutely. Like simple, right?
Yeah.
Yeah.
Got some color and everything. So, basically, I appreciate the opportunity to come in. Happy to do this whenever you like. I will sort of give you a preview that I won't be able to generate something in this depth every week, because it took me the weekend to do it. That said, there are a couple of things. The bottom line, to cut to the chase, overall, Geauga County is actually in pretty good shape, especially relative to Ohio, especially relative to the country as a whole, and also with regard to our region, Northeast Ohio. That said, there are a couple things we also want to make sure we're paying attention to. There's some trends that are interesting from an epidemiological perspective. Most notably on page 1 on the left-hand side of the graph, you can see as you go from left to right how the blue and purple represent a smaller proportion of the column, and the yellow and orange and red a larger proportion. That's our age distribution of new cases. That's something, a number of things could explain that. One of the probably most common explanations is when we see trends in disease incidence, we try to tie them to environmental change. And as we know that most of the economy reopened at the start of June, so most folks started coming back out and started doing things. There's a lag time between exposure and disease. There's a lag time between disease infection and disease onset, symptoms, testing, et cetera, et cetera. So again, no crystal ball, and the history books will help us 5 years from now understand this better, but right now it's evolving in front of our eyes, so we're doing our best. But as you look from June forward, we're seeing a larger number of cases. Some of that may be testing. I think in the U.S. as a whole, I think that's a very valid argument to say that we're seeing more cases because we're testing more. In Geauga County, we're really not testing that much more. So this is probably not just a byproduct of more testing. The reason that I'm looking at that one most in particular is because of, obviously, we're getting ready to send our kids back to school. And as we look at that red column, that under 20, again, some of that is folks going out there, going to the restaurants and bars and things like that, and that's, it's going to be expected. We're going to see more transmission. It's a communicable disease. It only transmits when folks are together. So folks get together. The one thing that, the other piece that concerns me a little bit is, we see almost all of our mortality is in the much older population. The reason for that is primarily because of the exposures we had in April and May with the senior homes, the facilities, congregate living. We don't have a large prison population in Geauga County. The kids haven't been back in school in Geauga County. The only other congregate living, or congregate space we have are the nursing homes. And we did have, a couple of outbreaks, one very significant one, but they happen. The concern for me as we get ready to have the kids go back is that even with the best laid plans, regardless, I mean, you can have the most amazing plan possible. It's a numbers game. The plans reduce the risk. It's like saying, I'm instead of playing the Mega Millions, I'm going to play the Pick 3, right? And change the odds. But if I play the Pick 3 10,000 times and I play the Mega Millions once, you know, I'm sorry, flip-flop. You're right, it's lower odds, but more numbers of people. Schools are essentially a congregate setting, in as much as folks don't catch us in their sleep, so, you know, where are they during the day, right? So this is one of the reasons that I really spent most of my summer working with all the superintendents, working with the Education Services Center, and helping them sort of design their plans, giving them guidance and so forth. Because it's not that every school is going to have an issue. It's that any school could have an issue, and that's why we're paying attention to the age thing. On the right-hand side of that, you see the trends by age group. Again, the older folks, the 60 and above, both of those trends have already peaked and are going back down. That's a good thing. The younger you get, the more increase you see. And again, they're smaller numbers, which is good, but there are more of them, and we don't, you know, we want all of these arrows to be pointed down. So that's where we're looking. So
Hey, Tom, real quick,
yes,
just not to
please.
interrupt, but
Yeah.
August, I know it's not complete, but are you seeing any trend in August, or are they following these
Yeah,
patterns?
yeah, I'm glad you brought that up, because I meant to mention something. Whenever we're looking at this data, and this comes up quite a bit on the social media posts and everything, when folks say, oh, the data are changing, et cetera, I look at it one day, it says one thing, another day it says another. Because of how it's reported, because of the lag time in tests, because of the lag time in return of tests, and the lag time in contact tracing, all of these are natural phenomena with the process. Data that are within the last 2 weeks really are very unreliable. And that's why, you know, I hate coming to you in the middle of August saying I've got data through the end of July, but at this point, I wouldn't be too surprised if we had 1 or 2 more cases in July still pop up. We actually just got a test result today from somebody who had tested positive on August 3rd. It's August, I mean, we're going to send a letter releasing them from isolation right along with the letter that's already sent. I mean, these are some of the things we wrestle with the data. The mortality data also has a lag time to it, predominantly because before it's recorded as a COVID death, it's verified as a COVID death. It's illegal to have a false, cause of death on a death certificate. The death certificates are certified. Doctors will lose their license if they put down the wrong thing and so forth, or intentionally. So the data that you can download from the state's website, those are current. But you'll also see on the right-hand side of the graphs, and I think I may have, I don't know if I copied one of them or not. Yeah, on the very last page, there's like gray bar. Those are, since those are preliminary, and that's because, expect those numbers to change. On the, you see that on the blue graphs on the very last, or maybe the second to last. Second to last page. Sorry.
Oh, yeah.
That gray area, that's why they're doing that.
I see.
So, yeah.
So the gray area would be what?
The gray area is preliminary. I would
Mhm.
expect that to change, again, because we're still learning about cases that existed in the first half of August, but we're just learning about them now.
Mhm.
So
So,
that's, yeah.
so the numbers that contributed to us dropping from, say, orange,
Yeah.
just a couple of, like, what is that, last week
Yeah.
or the week?
So
What
those
what
are-
were those numbers?
Yeah,
Like,
so
how-
those, and I've got a slide for that. Those are basically, they're gonna depend on which metric in particular you're talking about. Some of them are the past 3 weeks.
Hmm.
Again, and we can, well, if you don't mind, let me
Yeah,
take
that's
one
fine.
more,
That's
one more
fine.
pass at this slide, and then we'll move on to
Yeah.
the next one. Again, not only cases, but hospitalizations and mortality are all declining. For a period, we were very happy we didn't have any deaths at all in Geauga County after June 30th. Unfortunately, we did have a couple that have been certified. We've had 3, one in the end of July and already 2 in August that are COVID deaths.
Do you know any details on August?
I don't, in terms of the
Age?
I don't, I have to look, they popped in today.
Okay,
So,
okay.
Again, they happened before, but they just, got certified, so I wanted to make sure. On the right-hand side of that second page was a table there. And it's really for perspective, because sometimes we think, a number is a number, but it is, I had an old epidemiology professor's, his favorite two words were "so what," right? Because if you don't have something to compare it to, all it is just a data point, right?
Mhm.
And so I thought what would make the most sense is to take a look back, and so I went over the past 5 years and identified the leading causes of death in Geauga County, wherever there was on average more than one death per month, all right? And so you see that list over here on the right-hand side. And the number that you see next to all those causes of death are the number of people who died on average, not over the past 5 years, but on average over the 5 years, from March 1 through July 1. So we're comparing apples to apples, because we're not through this year, so we really can't count mortality for COVID. For the period March 1 through July 1, the leading cause of death pre-COVID is ischemic heart disease. That's not a surprise. These are the things that we would normally expect. Ischemic heart disease, 41 people, chronic lower respiratory disease, 19, lung cancer, 17, and so forth. During that same period this year, we've had 44, well, not, I mean, if we add August to it, up until July 31st, we've had 44 COVID deaths. That makes COVID-19 the leading cause of death in Geauga County. Is it a huge number? No, it's not, but it's the biggest number for any single cause of death in the county. Again, primarily are elderly, I would argue probably frail elderly. They're most likely nursing homes. But again, this is why we this is why we get anxious.
So
about
if you're
it.
saying, you're
Yeah.
saying that the overall death rate has increased in overall then, compared to last year. So our numbers, death,
Well, yeah, I suspect that when we get to the end of the year and all of the deaths have been certified, that will be an accurate statement.
Mhm.
Until we get to that point,
Mhm.
we won't have the data to say that.
okay.
But I think, if I was a betting person, I'd say that's probably the case.
Because that should be a glaring difference then.
You would see,
Right.
you would, and the language is that these are the excess morbidity, right?
Mhm.
Morbidity beyond the typical. And so, you're right, we should see an increase. Now, what we won't see is an increase of 44, because again, these are folks that are 60 to, 100,
Right.
right? And again, many of them would have, many of them, again, without not having had COVID and watching them progress, I would suspect that many of them would have succumbed to something else, most likely one of these other causes of death,
Mhm.
right? Again, in that age group, probably ischemic heart disease, vascular disease, and influenza and pneumonia. One thing that is, I think, worth pointing out is we get, and I'm glad I haven't, heard it here, but and I finally stopped reading the comments on social media. It's hard to do, but it takes a lot of discipline. But what we see often is this being compared to the flu. Well, if we combine influenza and pneumonia, and by the way, pneumonia kills more people than influenza, so influenza is less than half of this number. But influenza and pneumonia account for about 2 people a month in Geauga County, 2 deaths a month. On average, again, so that would suggest that influenza alone is about 1 death a month. So, yeah, I wouldn't say that at the end of the year we're going to see 44 more deaths in Geauga County than we saw last year, but I would say that it's very likely that it could be 5, 10, 15, and in the grand scheme of things, that's a
And the
those
last,
folks would still be alive.
and what about, like the other thing I've heard is, that being a contributing factor to, say somebody that's already in a very bad situation, whether it was COVID or it was influenza or it was pneumonia or, or a concoction of these different things happening all at once.
Yeah.
I mean, not to say it's good or bad, but, are you seeing that in, because I was talking to some healthcare officials, and they were saying that, they have a lot of these runs, especially in the winter, where it'll just come right through the whole facility and,
Yeah.
take out, way more than normal.
Right.
They'll have a bad season.
Right,
It'll,
right. Yeah, and really with any of the causes of death, especially as we get older, right?
Mhm.
We add those morbidities to our checklist of things that are wrong with us as we get older. Right? When we expire, it's almost always because our heart stopped or our brain stopped, right? That is not very useful information in terms of trying to prevent those things. It's saying, well, what are the underlying causes? So, and this is a conversation that's been happening for several decades in public health, is do we talk about, let's take for example, lung cancer or smoking? What's the cause of death? Well, lung cancer is the disease, but smoking is the lung cancer, right? So, but the cause of death would be lung cancer or COPD or emphysema or something like that. There are, on a death certificate, and the determination of cause of death is by the coroner or the attending physician at the time of death. They sign off on this is the cause. More often than not, it's the attending physician who had been either treating that patient or they've been hospitalized or whatever, because they know that disease history. So you will have, oftentimes you'll see things like the primary cause and contributing causes, and those contributing causes will be listed. And it's been a while since I've researched this. Well, learned about it 20 years ago. It's the cause of death that's actually coded and then gets turned in as when they do these rankings in the overall national database of the reason people die. It's not a pristine process, right? I mean, unless you have an autopsy, there's some things that are, right? A gunshot wound to the heart, right? It's not a heart attack, it's a gunshot, right? A fall, right? These are obvious ones. When you have something, a respiratory disease, it could manifest itself in any number of things that could kill you. The decision point with regard to why it's determined COVID-19 versus not, you'd have to ask the coroner or folks.
Okay.
But the process has, I guess the point being that we can still look at these trends because that process hasn't changed. It's an imperfect process, but it's the same imperfect process as last year, the year before, 10 years earlier, 20 years before that. They're human beings making those determinations. They're trained, but they're So one of the things that is a little bit more recent, although time flies when you're having fun, so it's not that recent, is this Geauga County Risk Assessment Indicators. Right, the state has issued these. I think it's now 6 or 8 weeks, 6 weeks, something like that. I don't remember. But where they have this 4-level system: yellow, orange, red, purple. Geauga County has remained yellow with a couple of bumps into orange, but for the most part we're yellow. And it has some meaning. It doesn't, and it shouldn't be taken to be more meaningful than it is. It's a tool. It's one of many tools that we have to sort of describe our relative risk to other counties. If you look on the right-hand side of that, well, look at the map. One of the things that we're paying attention to is overall in the state, because while Geauga County is a special place, eventually what's happening elsewhere catches up to us here. So we've been very fortunate in where we are that Ashtabula and Geauga County primarily stay yellow. Lake bounces back between yellow and orange. Geauga County's been red. Summit and Medina bounce back between orange and red. Right, so it's kind of this relative sort of trend. But if you look over on the right, the indicator that we will probably always trigger, and I would say that I kind of hope we trigger, given the nature of the disease, is that indicator number 3, the one that's circled in red. And that's their intent for that metric was to be a metric of community spread. So their thought is that if the new cases identified over the past 3 weeks were identified in congregate settings, a nursing home, a prison, etc., then it means that we don't have widespread community spread, that it's isolated to these outbreaks in these facilities, which you can control better. Now, I would argue they have much stronger negative consequences in those congregate settings because they're killing a lot of people in the nursing home. So the downside of this metric is it means that most of our cases are not in congregate settings. The upside to that metric, and I would still say that this is a positive, is that means that we're not having the outbreaks in the nursing homes that we had before. So I guess my argument would always be, as an epidemiologist, I look at this, is that I kind of always want to trigger number 3, because it's not an indication that we have a high rate of community transmission, because our case rate is still low. It just means that relative to our transmission within congregate settings, it's really, it's not in congregate settings, and that's a good thing.
Mhm.
Because if we can maintain that through the school year, we have aced this thing.
Mhm.
I mean, again, this may change when we get kids in schools, and we're gonna be doing a lot more testing, and
So-
kids are gonna be.
So overall, our congregate settings have stabilized.
Overall, our congregate settings
Yeah.
have stabilized, and that's a knock on wood one,
Yeah.
because.
I mean, there was really
it could
just
happen.
one
There was one big one,
Yeah.
and we've had, I don't,
early, but that was when, back in like?
April.
April,
Yeah,
yeah.
mid-April.
Yeah.
Yeah, mid-April was that was a very scary time.
Yeah.
We had the outbreak in one nursing home. We've had, technically an outbreak by definition is 2 cases or more of COVID.
Mhm.
There are certain diseases that are, and that may change given how prevalent it's becoming. There are certain diseases where 2 cases is an outbreak. Anthrax, smallpox, things like that, right? Most cases where you have an underlying, where they're endemic in a population and you have existing morbidity, it would take a larger number. 2 cases of pneumonia is not an outbreak.
Mhm.
Would you say that about 35 to 40% deaths come from the nursing homes?
In Geauga County,
In Geauga County.
I'd say it's probably higher than that.
Higher than that, higher than 40%?
Yeah, I'd say it's probably about 50-50.
Okay.
And that's because that's where our outbreaks have been, right? This is one of those where we'll have a better way to describe it after the fact, and that's the unfortunate piece of this.
Yeah.
If we continue the trends we're on, we're in good shape. If we don't have more of those outbreaks in the nursing homes, and if we can avoid them in the schools, we're in good shape. That takes work. I usually use the argument, the parachute's working, but we're not on the ground. The parachute's working, don't take it off, right? So we're not there yet, but we're definitely in the right direction. There's 3 indicators that I do want to point out. Indicator 1, 2, and 5. These are the ones that, for me, and I think in Geauga County have resonate the most. One is the new cases per capita, right? The second one is the trend in new cases, and then the indicator 5 it's a bad indicator in terms of data, but it's the best available indicator.
Mhm.
So it's not very precise, but it has to do with outpatient visits,
Mhm.
and that is the only indicator we really have of morbidity. These are the folks that aren't hospitalized; they can be tracked. These are the folks that aren't dead; they can be tracked. These are the folks that are sick, can't go to work, likely able to spread it to other folks. These are the folks we want to know what's going on there.
So this is
Yeah.
one thing I've had a challenge with, and I know some
Sure.
other states are doing this, and I haven't seen it from Ohio really, or at least not in a promoted way or, put out to the public or the media, but I know there's some other states that have been doing, or at least publishing the negativity rate, so they're tested negative.
Yeah, yeah.
The ones that tested positive, the positivity rate, the total deaths, the death rate, and then the average age of death. And then also, it was, hospital beds, total hospital beds, beds in use, that type of
Right.
information, along with the age.
Right.
Does Ohio do that? or-
Okay, so the Ohio Department of Health gets their data from a number of different sources,
Mhm.
right? And a lot of folks think the data comes from local public health, and it really doesn't.
Right.
The data on cases comes from the labs that do the tests.
Mhm.
They enter it into the system. The state looks at that database, but that's the database we look at to identify cases and do the case content.
Mhm.
The hospital data gets reported from the hospital systems to a different database that the state uses to track that. We don't have access to that,
Mhm.
so I've got the same wish list you do
I
with regard to
guess my
hospitalization.
saying is, it's all in, sometimes it's all in the perception or the eye of the way the story's being told.
Yeah.
If we're talking about the negativity rate versus the positivity, I'm not trying to, discredit it or
Yeah,
say it's
yeah.
not, but, I think it's good to have those two next to each other, so when people are making decisions,
Right.
and they say, the chances of this actually happening to, it's instead of just looking at, this silo here, and you're not getting the whole entire picture.
You're an epidemiologist at heart.
Right,
I'll
well,
tell you.
yeah.
Because it is.
I mean,
The biggest challenge is not having the data we want to be
Mhm.
able to describe the situation in its most useful way. And different audiences will want different elements of it.
But do you, I guess,
Yeah.
not to interrupt, but I think I've seen and I've heard a lot of decisions being made based on certain things. And again, not to
Yeah.
stress how important it is, but based on what they're hearing or being told, right? Instead of maybe having that other piece of the pie, the negativity rate, to say the chances are, but here's also the chances,
Yeah.
so, and I hear, a lot of and I've seen some even personally, and it's not really coming from the health department, I think it's people being proactive and trying to do the right thing, but they've taken it to a whole nother level based on what if, or, what, and, I think the human race, we are not based on, we don't live in what ifs
Yeah.
world. I mean, in a
Yeah.
perfect world, it'd be great, if we could all sit here and act like that, but if we're gonna survive and make a living and go out and our children are gonna be normal functioning kids, that, and I understand we gotta protect them, but some of the decisions I've seen have gone almost to the point of being like arbitrary,
Yeah.
where it's like, what is that based on?
Right.
Show me the data that backs that up,
Well, and so one of the challenges in public health in particular is that our focus on prevention.
Mm-hmm.
Absolutely statistically impossible to demonstrate what you prevented.
Sure.
Because it didn't happen. So it truly is a lifelong pursuit of, of being wrong, right?
Mhm.
Because if you do the things and it didn't happen, you overreacted. If you didn't do it, it did happen. You didn't do it very well, right?
Yeah.
So the issue with that data, there are, and I'll be right there with you. And not to be, the Monday morning quarterback with the governor and his decisions on things, and
Mhm.
just the incredible amount of managing all those task
Mhm.
forces that are coming up with the recommendations and so forth. Please, I don't know anybody get that
Yeah,
right.
right.
Okay? That said, it is very confusing to the public. It's very confusing to me,
Mhm.
and I have a very difficult time answering questions on the phone from the public who want me to explain why
Mhm.
we have a 10-person limit for social gatherings, except
Mhm.
this.
Right.
And it's like, I get it.
Yeah,
I get it.
right.
The reality is, and so my common line is that the current governor's orders say this. What you've described doesn't sound like it meets that. I agree that it's confusing.
Mhm.
It's also, those goalposts get moved quite a bit,
Yeah,
and I
yeah.
get that. Part of that, and again, hindsight is always better. They're trying to stay ahead, and it's a lot of adjustment. It's when
Mhm.
you do something and then it's not working, you have to take a step back. Or if you're doing it and there are unanticipated costs,
Mhm.
then you step back. And I think that a lot of that was probably demonstrated when, gosh, when was it, back in March, April, when the stay-at-home orders, right?
Yeah.
And everything kind of shut down, and then it's like, well, all right, now the economy's dying,
Mhm.
right? So we've got to open up. It comes with risk. I mean, we've seen what happens with that, but we also have folks that are able to make a living now,
Right.
which is also a necessity.
Exactly.
So
No,
it
it's a
is.
good point.
It's a-
I think
it's a,
that's good, and it's
managing
tough, and
balance, yes.
I don't think anyone can fault, early on especially, some of the decisions that were made, I mean, I would not want to be in that position, and this was something new,
Yeah.
novel virus, right?
Yeah.
And,
It's been 100 years since we've seen this stuff.
yeah, so, I mean, nobody can fault it. But I think the big thing, I think, is taking responsibility and accountability when you are not right, to
Yeah.
at least acknowledge that and
Yeah.
explain why you weren't right, and then
Yeah.
move on. And I think the public will
Yeah.
totally accept that,
Yeah.
It's
Well,
when you-
I think you get a lot of credibility when you
Yeah.
are able to do that.
Yeah.
One of the things that I've been trying to do, anytime I've got somebody on the phone that says, "Hey, can I do this thing?" It's a conversation. It's not just, this is satisfied that order or this doesn't.
Mhm.
What we try to do is take a look at other things that are also going on. What are the benefits? Well, how specifically are you doing that? Because maybe, by the letter of, this might not be consistent with that order, but if you do it this way, you're actually reducing that risk enough that you can do that. we do a lot of that, and
Mhm.
I don't, I don't want to go through the list of them, because then I'd basically be saying in all the ways that
Right.
we're being lenient.
Right.
Euphemistically lenient.
No, definitely, yeah.
But it's also, those are the things that folks don't hear about, because people generally don't complain when they're allowed to do something.
Sure.
And so I just want to make sure that you all are
No,
aware
I
of
mean,
that.
I know,
the
you know, and I've
majority
talked
of
to
those
in the
things,
businesses,
yeah.
and I know
Yeah.
early on, we had this discussion
Yeah.
about that involvement,
Yeah.
you know, how it was gonna interact with businesses
Yeah.
and not
Yeah.
being punitive
Right.
and being more educational
Yeah.
and supportive of, you know,
Yeah.
the changes.
Yeah.
Obviously, you're gonna have a couple, you know, outliers that just will not comply with anything we're doing, but I think, from what I've heard in Geauga County, there has not been anybody that we've had to, you know.
The Geauga Board of Health has
Yeah.
taken no action
Right.
against anybody.
Yeah, so,
Business or individual.
right, so,
We'll go talk to them. I mean, that's our job. It's a
Yeah.
responsibility. We have this, you know, it's like, hey, guys, come on, you're not doing this thing. You're supposed to be doing this thing.
yeah.
But, you know,
No,
someone
I
could-
appreciate that.
Well, I mean,
Yeah.
it's a balance. And
Mhm.
honestly, the nature of public health is one where we depend on all of those other sectors to be successful. Because the best predictors of a healthy community are a strong economy, are a well-educated population. Those are the two
Mhm.
biggest pieces. Because what they provide is, you know, we often go back and say, well, we want people to make healthy choices. And that's great. Take personal responsibility, make healthy choices. That's great for those of us who can.
Mhm.
One of the things that public health recognizes, and when I was president of APHA, went around the country talking to state public health associations, saying, look, you need to build those relationships with the business community, and with the school systems, because those are the things that are going to increase people's menu of choices. We say make healthy choices, but if you can't afford that healthy choice, it's not going to happen,
Mhm.
right? So we want folks to be employed. We want businesses to be successful. We want kids to be educated. And I think that the schools is a really good example of that, because purely from if our sole goal was to reduce transmission of this disease, if that was it, if that was the only goal in mind,
Mhm.
kids wouldn't be going back to school,
Right.
right? I mean, we're going to see more cases because kids go back to school. It's just going to happen that way. But at what cost? And if you don't go back to school, you don't have that socialization, you don't have that education. Which is, again, why we've also been doing our best to make sure that we're letting folks know about the risks that could help those schools not have those outbreaks.
Mhm.
We've had lots of conversation. I mentioned the other night, we don't have any intent to tell schools not to have sports and things like that. That said, I was on a call last Thursday with the superintendents, who were actually, some of the superintendents were asking me to do that.
Mhm.
I said, yeah, that's not going to happen. And they said, well, you all can do that yourself. You've got a school board.
Mhm.
They said, well, yeah, our school board members say, well, yes, but we have levies, and we're not going to pass our levy if we cancel the football season.
Exactly. This
All
just
right,
goes
well,
back to
these
what
are
we were
right.
talking
These are
about.
things, and I said, well, hey, we
Yeah.
got a levy too.
Right. This is what I was frustrated about. Remember talking to you last
yeah.
night, you know, is
So
this
these
kind
are-
of,
These are the
Yeah.
conversation, the way the conversation unfolded was, look, we're not gonna, and I have a board member here, they can, you know, if they change their mind, that's fine, but from my perspective, I'm not giving them the recommendation that we take any action whatsoever to close the athletic, you know, programs or band or anything like
Mhm.
that. The reality is that those things do present a greater risk
Mhm.
for transmission amongst the student body, because you're having squad play, right? An outbreak at one school could, you know, easily go through. You have folks that are in close contact. You don't see I love football, but
Mhm.
you don't see a football game where people aren't within 6 feet of each other.
Right.
So these things do add a level of risk. So we will have conversations with the school boards, the school superintendents, saying, here are all the factors,
Mhm.
your decision.
in really some extent, you know, not to get too into this,
Yeah.
but they've been doing this all summer long, you know,
Yeah,
practicing and
yeah,
doing all these
yeah.
things, you know, I
Yeah.
mean, obviously, if we get to a point and all of a sudden we see these things start turning around and going back up again,
It's
you're
another
gonna have to adjust,
conversation.
right? It's
another
a different
conversation
conversation.
another time.
Yeah,
Absolutely.
right.
And that's because it's evolving in front of us.
Yeah.
Before I move on, and I don't
Yeah.
want to take up too much of your time,
No,
I
no.
appreciate it.
This is good.
One of
Appreciate it.
the other concerns, and any ideas you all have, any public comment you all can make. One of the concerns we're seeing, and we had an issue here in Geauga County, but we were on the governor's call yesterday morning, and I heard from a number of other health commissioners are having the same issue. We have, because we're dealing with kids, when we have a positive test with a kid, we don't interview the kid, we interview the kid's parent. We have some parents out there who are convinced that this is nothing, and are refusing to cooperate with the contact tracing. I got a call on Friday last week from a very upset mother of somebody who was in a band, a high school marching band. They were at practice. They've been practicing for, for weeks. And there's no way to substantiate this, so I will say that this is just the report from the mom. We have no way of knowing. Mom said, hey, my daughter came home, said her friend so-and-so had tested positive. Her mom did the case contact interview and refused to identify any contacts, did not even mention that her daughter was, or son, I don't know, was in the band. It's my assumption that they would have been, the individual would have been isolated, but up until the point they're isolated, the whole time for 48 hours before they became symptomatic, the entire time until they got tested, and the entire time until that test result came back, they were potentially infecting other people in the band, and nobody knows because mom wasn't cooperating with us. The contact tracing is absolutely voluntary. There is no legal action anybody can take for folks not doing it, nor does it make sense because folks, it's self-reporting, right? We depend on folks to share that accurate information. If they don't, we're going to have folks that are at risk and don't know that they're at risk. Even, and quite honestly, even if that risk is low, it's there. That student that might not be impacted negatively is going to go home and give it to mom, dad, grandma, grandpa, whatever.
Yeah.
So that's my concern right now, and that's not specific to band or football
Yeah.
or anything like that. It
And
can
it's
happen.
not rampant,
It's-
right? I
It's,
mean, that's
it's
going
not,
on. Yeah.
but that is, in my professional opinion, the biggest risk for transmission is not isolating the folks that are exposed. That's why we do it. That's why,
Yeah.
I had a test on Friday
Yeah.
and didn't go out over the weekend. My test came back.
I mean, it
Sunday,
makes
came
you
back
wonder
negative.
though how many truly slip through the cracks that
Oh.
you really just that aren't getting tested or don't even come in contact. So I mean,
Yeah.
you know,
That's why
I know
it's
you're
going on.
concerned about
Yeah.
that one, but
Yeah.
I mean, how many more are going on the side?
That's
So,
and that's why that's why it's still here,
Yeah.
right? Because if everybody that was positive
Mhm.
knew they were positive and isolated so that they weren't infecting others, this thing would have been gone in
Mhm.
3 weeks.
Mhm.
Because it just doesn't live that. The virus doesn't stay viable. It needs somebody to go to. The only reason it's here is because we don't know who all has it. We don't know who all they give it. So it's just, and is that going to bend the curve by having everybody participate? No, but it's going to stop it from making it worse.
Absolutely.
So anyway, that's that.
Yep.
The, just a couple of things I already said, Young County is relative to our region and the state is in good shape. We represent 0.8% of the population, but only 0.5% of the cases. We're carrying our fair share of the hospitalizations. Again, 0.8% of the population, 0.8% of the hospitalizations. We do, again, because of our April issue in the nursing homes, have a higher burden of mortality because we have a higher proportion of our population that has died from COVID relative to other counties because they didn't have that. Some obviously did have those outbreaks, but as a rule they didn't. We get a lot of requests for the number of folks that have recovered. So just to be clear, the best anybody's been able to come up with for what recovered means, it means folks that had symptoms and had gone more than 21 days who have not died. That's recovered. It has nothing to do with long-term morbidity. It has nothing to do with anything other than you had symptoms 3 weeks ago and you're still alive. You're recovered.
Even if they had like the sniffles or something.
Well, yeah, right. So they're included.
Yeah.
So that's where we are. Technically they could have got it had symptoms 3 weeks ago, got tested 2 weeks ago, found out last week, and still be in the hospital and they'd be considered recovered. So take that one with a grain of salt.
Right.
See that recovered one. And then finally, this is just the last page with the table on it. Those boxes that are in red represent the first one, that 613 is cases per 100,000. And this is for Northeast Ohio, those 8 counties that represent sort of our region. You can see that our 613 per 100,000 is considerably lower than the 923 for the region as a whole. Our hospitalizations, 105 compared to 145, and our deaths are for our region are really, none of these are statistically significantly different because there's so much variation. I mean, you throw in Cuyahoga County and
What happened with Mahoney that it went so high?
I'm not sure. I think they may have had
Some
some nursing home or perhaps some incarcerated population. I think that those were congregate care settings or congregate settings as well.
I see.
Most of what's driving the mortality, the deaths, most of that is congregate settings. And as I usually don't compare the three, but the 3 kinds of congregate settings we have in our country are nursing homes, prisons, and schools.
I see.
So again, I don't want folks to be afraid of school, but I want folks to understand that we're moving into a situation where we're putting what we believe to be a far less vulnerable population, but we're putting a lot of them together.
So what are we doing as far as like how you're gonna be monitoring that, this opening days pretty closely?
So, yeah, so I've been working consistently with the superintendents. They've been sending me their plans to review. The state says that, we need to approve them. I say, if for me to be able to approve it means that I would be able to approve or be allowed to disapprove it, and I don't believe that to be the case. So what I do is I simply say, hey, this is a really good plan. It looks like you're good. Right. It looks like that you've taken all of the recommended steps to reduce the risks to the extent possible. Obviously, keep in mind it doesn't eliminate those risks, and you have a plan for what to do in the event that you have cases. So we've got that relationship now for several months. We're also working on, and I've reached out to my colleagues around the state, and nobody else is doing this, but what I'd like to do is, because the contact tracing process for a school is going to look different than it is in the general population. General population, I gave you a call, say, hey, when did you start feeling bad? You said Tuesday. I said, so what you've been doing since Monday? We've been coming contact. And it's, not that simple, but it's kind of that simple. You may be giving me, 8 people that you came in contact with. In a school, you got little Johnny's sitting in the classroom. I got to know how far apart Johnny's neighbors are, and who's sitting next to him, or even maybe who's sitting 2 seats away from him. I need to know how interactive is that class. I need to know, does Johnny stay in that class, or does Johnny go from 1 period to 2 periods to 3 period, multiple classes? What we're dealing with then is a contact tracing process that could generate, from one case, could generate 30, 40, 50, 100 contacts. I don't have that many contact tracers. This only works if you can do it very quickly. If by the time we find out your contact, it's been 10 days, it doesn't matter, right? So what I'm working on is a plan where, because we have predictability for where students are, at any given time, you can call a school and they should be able to tell you where your kid is, right? The little Johnny's scheduled at this time to be in this class. So I know little Johnny's schedule. If we have assigned seating and seating charts pre-populated, I don't have to interview somebody. I go, oh, here it is. We've got this information. I know that Johnny's in, drama club after school. All right, great. I know, these are the other folks who are doing the acting. You don't have to worry about the set crew because they weren't interacting, blah, blah, blah. If we can predict that on the front end, and we can take the idea of every school will have an emergency contact list for every student. Johnny falls down on the playground, twists his ankle, needs to call somebody. School principal, administrator, somebody knows who to call. If we just take that sheet and we can expand it to say, on any given day, because it's not going to be perfect. We can get 80% of them, I'd be thrilled. On any given day, little Johnny comes into contact for 15 minutes or longer within 6 feet with this list. I've already got my contact. Now we just need to start contacting those folks. And guess what? The school already knows their contact information because they've got an emergency contact list. That, if we can do that on the front end, and I've talked to a couple superintendents, and I said, I know you can't do this before school starts. And you probably can't do it in the first week school starts. But if you can do this in the first month school starts, we'll have it when we need it. And we can make
So
that
how are they
process
gonna keep up with testing all these kids?
They're not.
Huh?
They're not.
So then they're just gonna wait for, Like somebody to get really sick and then go from there, is that the idea?
No, the idea is to test everybody, but, you know, the first question was, can they do that?
No.
I can't imagine that they can. We haven't yet been able to do that.
Right.
So this idea of, and this is where the pragmatist in me comes in. I mean, it overtakes the epidemiologist. The epidemiologist says stay home until you get a negative test.
Right.
That's not gonna work. Everybody would stay home. So that's when we take a look and say, well, the most likely period of infectivity for you, the period where you're gonna, most likely, if you have it and you're gonna give it, is this period of time. After that period of time, go back. Because there's just no way. I mean, everything would stop.
Right.
I would love to be able to sit here and tell you that we've got the capacity in the state or the country to test everybody when they need it. We don't. It's just not there. And as with the governor's experience before, he got those tests, right? That first test, that quick one, it was a rapid test, it was an antibody test, okay? It can give you a quick result. It's very sensitive, it's not very specific, so you're gonna get a lot of false positives. Well, that's not gonna do you any good if you wanna use a quick, readily available test to clear somebody to return to school. If it's coming back false positive, it's
Right.
really gonna turn it in the other direction. So right now, and we're, I think, on the verge of other tests that will be able to be quicker. I think somebody's working on a saliva test and so forth, that are more accurate, then,
Fast.
then maybe, and when that happens, I don't know.
Yeah.
And it's kind of like the vaccine. When that happens, who knows? How long the immunity lasts, who knows?
Tom, the first couple of months when essential businesses were in operation of Geauga County,
Yeah.
and some were shut down, but you and your office and county prosecutor would field phone calls.
Yep.
And you'd take visits to different companies, and you'd go out there and guide them.
Oh, yeah.
And
then-
suggest some things.
And then they call each other and start calling us and ask us to come out.
Right. So
Yeah,
it's a little bit
cool.
of everybody calling,
Oh, yeah.
tattletaling on certain companies or
Well,
employees that were
yeah,
stayed
yeah,
home,
yeah.
or half the crew was stayed home and half worked.
And some of that really hasn't changed too much. We do have folks, I will say that I've never spent so much time in my life on the phone and answering emails. Probably, if I get a dozen calls, 15, 20 calls maybe in a day, it's an even split. Half of them are screaming that these folks aren't wearing masks and they're not keeping distance. These folks are saying, don't you dare shut down this, that, or the other, right? So it's just one of, and for me, while it's a very hard day to do that all day long, it's kind of the definition of being moderate. Because if half the folks think you're doing too much and half the folks think you're not doing enough, you're probably, pretty close to being in the center. Again, not a very fun place to be, but we do, the folks on the early end who were, I guess, reporting on their employer, have been largely replaced by reporting on their neighbor, or I had this bad experience at the grocery store or the big box store, whatever. And it's been a challenge because, again, we're not going to go out and say, we don't write tickets, we don't do that. But we can go out and help the stores and say, well, treat this like you would if somebody were to walk into your store and take off their shirt, or walk into the store and light up a cigarette, right? It's really not that different. The reality is we live in a little bit different world. You tell somebody to put on a mask and they punch you in the face. So that's their reticence, but I think potentially one solution is these stores that do have these policies that say, you need to do this if you're gonna be in our, it's private property.
Right.
You're gonna come on our premises. You need to do these things. And if you don't, it would be trespassing. Well, now we're talking about something. This trespassing is trespassing. The problem there is a capacity issue. It's like, well, wait a minute, are we gonna spend now I'm not even talking about my resources, but is law enforcement would spend all this time trying to track that down at the expense of what else that, and there aren't the resources necessary to enforce any of this.
There's no perfect answer there. One other question I had too was what happens, as kids are going back to school, and then, we're gonna have a normal cold and flu season coming, right?
Yeah.
So they're gonna have all of this, mixed up together.
So the kids, so what's gonna happen, I suspect, without a crystal ball, and all of the plans that I've reviewed, we've been very clear to say, if you have any symptoms, and cold and flu symptoms overlap COVID symptoms. I had one of my employees had cold symptoms. I said, stay home. She tested positive for COVID. Really glad I told her to stay home, because otherwise we'd be quarantining the health department, right? That's why we have to have those policies. That's why schools need to have those policies. If you've got any of these symptoms, and it's a long list, you need to stay home until they go away. Now, it seems harsh, except if you reframe it and say, hey, folks, don't send your kids to school sick. It kind of resonates, so it's like, well, duh, you know,
Yeah.
that's kind of common sense.
You should do that.
The reality is that a lot of folks don't have that option. We live in a world where folks can't just say, well, I'm going to stay home with my son because he's sick. Well, maybe I don't have sick time,
Mhm.
right? So that it's going to happen. When kids present at the school and they've got, let's say, a fever, maybe a fever and a sore throat, probably cold. Odds are it's a cold. We want them to be home because we don't know that it's a cold. And if it turns out that they progress and they go get tested and it's positive, we want to be able to do that interview and have them say, I didn't get anybody else in school sick because I've been home. That's the answer we want. Because the only other answer is, yeah, I went to school, I was sick, I thought it was a cold, tested positive a week later. Now, that school may be closing down because, not because we've closed it, but because they've got such a high rate of absenteeism
Mhm.
that they've decided to do that.
Yeah.
So yeah, it's going to be mixed. Now, will it change the data? No. Because just because folks come home or get sent home because they have symptoms does not mean that they show up in our data as COVID cases.
Yeah, I was wondering about
The
that.
only way there's only two ways that you show up as a case in the data. One, if you have a positive test, because that lab, it's a Class A reportable disease, that lab by law has to report to this, it's called the Ohio Disease Reporting System, ODRS. They have to report that positive outcome, right? So that's one way. The other way is if you are identified as a close contact through our interviews, as a close contact of that individual, and then you become symptomatic, then you may be called a presumptive case, all right? In all likelihood, those folks then get tested. If they get tested negative, you're back out of the data. If you get tested positive, now you're a confirmed case. So the data on our case numbers, I know there are a lot of folks that think they're inflated. They're actually probably very conservative
Mhm.
because, again, you're only capturing a small portion. You're only capturing those folks
The
that
people
get
that are
tested.
getting tested,
Right?
yeah.
Asymptomatic people who don't get tested don't show up in the data even though they might have it. How many of those there are? We don't know.
Yeah. Yeah.
So when school starts, you're anticipating more phone calls?
Yeah. Yeah. It's gonna be interesting. But that's all right. That's why we're here, right?
Has there been any other discussion about, I think there was a lot of people who believed they had it early on, even before March and the
Mhm.
shutdown and all this, but that there is any type of build-up immunity to this yet, or?
A lot of recent conversations about immunity, and it sort of raises two issues. One, this idea of herd immunity. And if I can't, so herd immunity is when you have enough folks that have immunity to something that the virus, herd immunity for this group of folks would mean that if I had it, enough of you had immunity that it was unlikely I gave it to the one of you that didn't,
Mhm.
right?
It just runs out
And then
of
it runs
steam.
out,
Yeah.
right? So right now, the best estimate is that in Ohio, 1% of the population has been diagnosed with COVID, which means that maybe, again, this is a maybe because we don't know. If somebody isn't tested, you don't know whether they had it and just weren't tested. But that they expect that it could be, maybe 10%, 8 to 10% of the population actually has had it. 1% of them.
They're only capturing the 1%,
Right,
yeah.
1% of the population has been diagnosed with it. If you look at the number of cases relative to the
Mhm.
population size. So we're a long way from just getting there naturally, and
Mhm.
we've had a lot of deaths. If we need to get from 8% to 80%, you multiply those deaths by 10 as well.
I see.
Right, so we don't want to get there naturally.
Mhm.
Typically, when folks talk about herd immunity, it's as a consequence of vaccines, right? Because you can give people the vaccine without them getting the disease, which is a lot safer way to get to herd immunity.
Mhm.
So there's those two pieces. So when we do get a vaccine, and I'm sure we will at some point have a vaccine, two questions then arise. One, what about the population that says, yeah, no thanks, right? And we do have a growing number of those folks. And quite honestly, I mean, this is a rush vaccine. I'm not, I haven't decided it myself.
Yeah.
We'll see. But then there's also the conversation now, and again, we're in the early stages of this, of how long does that immunity last, right? We've all heard of booster shots, right? You get
Yeah.
tetanus, right? Lasts for X number of years, your immunity wanes, you have to get a booster. Coronaviruses in general, and this is one of a list of coronaviruses. It's a new coronavirus that we know of, but it's a coronavirus. Coronaviruses in generally do not confer long-term immunity. So, you know, we don't know, does that mean that if you have it, that you have immunity that's going to protect you for 4 months, 6 months, 5 years, 10 years? We don't know. I mean, we're 8 months into it, right?
I mean, the flu shot, you know, kind of is like a 50-50 deal anyway, right?
Well, yeah, so that's kind of a little bit of a different situation,
different?
because
Okay.
number one, the flu is going to be a different strain each year. And so even with immunity against one strain, might partially protect against another strain depending on how
I
similar
see.
it is and what gets triggered in your body to fight it as soon as it recognizes it. So that's really all immunity is. It doesn't protect you from getting it, just your body's already queued up to knock it out. It's sort of the shock and awe as soon as it sees it. So it depends how similar that
Oh, you got it.
is from year to year. The flu shots, the benefit of a COVID vaccine over a flu vaccine is as far as we know, again, 8 months into something that we haven't gone through multiple years of, is that the coronavirus, as far as anybody knows, isn't really changing. So
So you can
the
knock it
hope
out.
is that we could have a vaccine that will give immunity to enough folks for a long enough period of time where we can have herd immunity.
Oh.
Downside is, if that herd immunity lasts this long, as we move forward, we're losing all these folks. They're no longer immune as we go through time, right? So to get that high level, and for most diseases, herd immunity is anywhere from 60 to 95%. 60 would be, you know, for a fairly rare, very non-infectious kind of
So
disease.
are there other strains of COVID out there besides?
Not to my knowledge.
No.
But I have not asked that question, but not to my knowledge. I think that I think there's some variations, as far as I understand, because but I don't know that they're necessarily different strains.
Yeah.
Much as.
Like,
as
is
they're-
the
it's not
flu
identical.
called a COVID or no?
Pardon?
Is the common flu?
No,
No.
Influenza is entirely different.
Oh, okay.
Yeah, it's a different
Different.
mechanism.
Okay.
Yeah, different piece altogether.
Excellent. Well, this was very informative, and I'm glad, and I appreciate you coming and doing this, because,
Yeah.
you know, I've had a lot of questions kind of build up over, you know, people ask me questions, or questions of my own, or, so
Yeah.
this is good that you were here to answer a lot of that, I think.
Maybe we could do a follow-up a couple weeks after school, maybe he comes back and.
Yeah.
That'd be great.
Just
Could we maybe plan for, just again, because of the
Yeah.
lag time?
Yeah.
Could we maybe
Month or
schedule something,
something.
you know, October, middle
Yeah.
of October?
Yeah.
Yeah, that would be
Be
great.
good, that way you have a better, you know, you'll have the August, and you
Right.
see where, if
Yeah.
this thing's turning or going back, which way, yeah, yeah.
Also, I attended the meeting you had with the Fair Board
Yeah,
last Tuesday, I think it was. And I'd like to resurrect the conference calls at least once a
Yes.
month with Tom, and even add somebody from the Fair Board, just so that communication doesn't fall apart.
Mhm.
And whoever wants to be on the line can be on the line, you
Oh,
know,
yeah.
the sheriff and you and Roger Peterson from Emergency Management, in case something comes up that, you know.
Or even, you know, every couple of weeks. You know, I think originally we were doing it three times a week. and-
Right.
And it got to the point where it's like, yeah, nothing new, nothing new,
Right.
nothing new.
Yeah.
Well, because
But it's
time
still-
progresses,
it-
there's less new, but.
It's kind of still here, so I think
Oh,
we
yeah.
should, at least once or twice a month, have a conference call, and whoever can make it, can make it.
Yeah,
If, you know,
I'll make it every time.
Okay.
You know, speaking of fairs real quick, were you able to see, or not you, but any information coming out of the fair so far in the state of Ohio? I mean, I know there was that one where they had that was like the one they were saying, oh, there's all these cases and da-da-da, but overall, with the fairs that led up until the cancellation of it, has there been any concrete evidence that those things were super spreaders and all this, you know, was gonna kill
So,
children?
yeah,
and,
again, it's
you know,
it's one of those where, because of the likelihood of something happening,
Mhm.
you need a larger sample size.
Mhm.
So within Ohio, we haven't had that many fairs. I'll take a look to see if there's any national level data. I mean,
Yeah,
county fairs
it'd
are
be
not unique
interesting to
Ohio.
see, you know, I mean,
Yeah.
I understand the thinking.
Oh, yeah, most of this is
proactively-
just based on the logic of
Yeah.
numbers of bodies sharing the same space.
Yep.
I mean, that's
I
most
get it.
all of this.
I get
right?
that, yeah.
So, but I can take a look and see if there's some data on that.
Yeah, it'd be good to know that, you know, just the reality of things, and I know, you know, again,
Yeah.
a lot of this is Monday morning quarterback, but
Yeah.
it's good to at least acknowledge what we were saying, you know,
Oh,
like
yeah.
early on, we were saying, you know, 1 million deaths in Ohio or something, remember, I forget what it was. It
I
was-
don't remember. yeah.
And it's okay then to say that, but then you do have to acknowledge what you said and
Right.
correct it.
Oh,
You know,
yeah,
we
yeah,
can't just keep
yeah.
plowing forward.
And I,
just-
yeah, I've had
Yeah.
this conversation
Yeah.
with folks about when
Yeah.
they are very critical of mathematical modeling.
Mhm.
And I tell them, you know, mathematical models are actually by design built to be wrong.
Mhm.
Because a mathematical model is something that evolves over time, and the more data you add to it, the more precise it goes, it gets. And so by definition, it's going to be wrong.
Sure.
I think that like I said, I'll take a look for
That'd be
the data
great,
on
yeah.
that. There's a good chance it'll be, you know, a year, 2 years before somebody
Before,
actually
yeah.
knows that
Right.
sort of answer.
Right.
Because honestly, as an epi, I'm sorry, former epi, doesn't really leave you, but I would say, well, not only do we look at this year, but we have to have some benchmarks. If that's so what, it's just a number
Mhm.
thing, right? If it's, you know, 1 in 20 fairs, right?
Mhm.
But if it's, this year we had X number of cases that were tied to fairs, next year we didn't, right?
Mhm.
It's the what is it overall? So,
Right.
yeah, I mean, it's a
No.
great question. I
I know that
and look at the data.
there's not
eventually.
answers for
Yeah.
all this stuff yet, but, yeah, or
Yeah.
ever will be maybe.
Yeah,
but,
well, we'll keep looking for them,
Yeah,
right?
but, yeah, great. So does anybody have any questions? Yeah, your name and where you're from?
Brad Deming, Chesterland, Ohio.
Yes, sir.
Is this information will be available somewhere for us to see it?
Yeah, I actually,
Yeah.
I made it available, so it's a public record. I don't know if it's something that folks would ask you for, or. as
We
a-
could,
Yeah,
yeah,
it's available.
yeah,
Will it
anybody.
be posted on the website, or?
I mean, I can give you, or, yeah, Rich, thanks, Rich, yeah. Thank you, yeah.
Okay. Second question, I was at your meeting at the Fair Board,
Mm-hmm.
the Junior Fair Board, and I passed out constitutions and all that stuff. Have you had a chance to look at those? And if you have, I wanted you to present your authority for all your closings or suggested or mandated closings and all the businesses and everything in the fair.
Yeah, I'd be happy, let me kind of address that from the back end forward. For all of those closings and mandates and everything, there have been 0. The Board of Health has closed nothing. The Board of Health did not order the fair to do anything. The Board of Health has not closed a business. The Board of Health has not executed any orders against any
Well,
individual.
why is the Jog County Fair closed?
The Geauga County Fair is, the governor of Ohio ordered the fairs to go to
The
June.
Governor of
fairs.
Ohio doesn't have that authority.
I don't represent the governor from Ohio. The question, I think, might be better asked to the governor. I'm not responsible for the governor's authority. We did not close it. We've been given the guidance that that's outside of our authority, so we didn't.
So you could tell Paul Harris he could open the fair,
I could.
because he has no, there's
My,
nothing to.
my role in public health would be to share information. My role in public health would be to make sure that Mr. Harris is aware that the governor had issued that order. And that's what we did when we communicated with him.
Did you ever
We
suggest
did
to
not
him
order.
that if they wanted to open the fair, they could post signs and just saying it, you know, you enter at your own risk, or if you want to wear a mask, wear a mask?
Sir, so just to be clear, well, you know, I don't believe we're talking now about the legal authority, because I've already said I don't believe that we do have legal authority to close it, which is why we didn't. That is a very different conversation than saying, do we believe from a public health perspective that congregating, you know, 10s, 20s, 30, 50,000 people into a common space is in the best interest of public health. So no, I would not communicate to anybody to say, I think that this is a good idea, if in the interest of public health, it wasn't a good idea. It's a communicable disease. That's a different conversation than did we order them to close. We didn't order them to close. But that doesn't mean that I'm going to tell them to
Okay.
open. They're
No,
two
but
different
I'm
things.
Thank you.
confused.
Any other questions? Anybody have any questions? Oh, okay. Yes,
I
sir.
do.
Your name and where you're from?
I'm Paul McCutcheon from Munson.
Munson?
Hey, Let's roll back, because I followed along with these conversations with Paul Harris, and just because you don't directly tell someone that us as the director of the of our health department are closing this fair, but you do infer those things onto them and say, hey, these, by the way, we're informing you that these were the governor's orders,
Correct.
whether we agree or disagree to them. We're just giving you the information that
Correct.
these were the governor's orders.
Correct. And I've done that several times with them,
Right.
yes.
When you say that to Paul, you're essentially telling him that same thing. It is inferred that you are now giving this, any other information that says, by the way, constitutionally, he cannot do this, but this is what his orders were, whether it's valid or not. And then, of course, maybe this is our opinion, that we agree with this or disagree with this, or doesn't matter.
So it sounds like that's an issue of style. I can't be responsible for what any individual infers. All I can do is share that information. It's kind of the same argument when we present data and people say we're trying to scare them. We're not. We're presenting data. It's the same sort of thing. I would like for the Fair Board to understand, and we were very clear that this was a request.
Recommendation.
I think it was a recommendation.
Yeah.
That the Fair Board exercise its authority. The authority was the Fair Board's. The authority wasn't the Board of Health, and we made that very clear in the resolution.
Correct me if I'm wrong, but about 2 days before the governor's orders were actually issued for the fairs, and I'm sure that you're on calls, in those calls with the higher state government, the communication kind of went from phone calls daily with the Fair Board to just emails only, as reported in the,
I did.
Sir, we went over this at the board meeting with the Fair Board. I don't know if you're familiar with that meeting or not, but, I think everybody involved, including Tom, will admit that, and he did, that it wasn't maybe communicator handled the best way, the way this thing happened. You know, to some extent, not that I agree with all the things Tom's saying, but, but this is what they do. They make recommendations all day long about certain things. Now, the Fair Board didn't, if the governor had not come out with that order, it was within the purview of the Fair Board to continue on with the fair. And it most likely probably would have, But that being said, the DeWine put that order out to stop fairs. Now, is that legal? Does he have the legal authority to do that or not? That's a different question, but for Tom Quaid, really, you're just asking his opinion at this point on that.
I'm actually more asking, is he a servant of the state or of the residents of Geauga County? And
Yeah.
trust me, I know that you're gonna say Geauga County, but I'm not always seeing those actions, and trust me, my opinions and those of this entire room are going to differ.
Sure.
But we're adults and we can make our own decisions. And ultimately, you are doing a very good job on informing us of that, but we need a backbone of our local government for this, against the state.
Right. So it's, my role, again, is not as an agent of the state. I don't have any connection to the state. They don't pay any of my salary. I report to the Geauga County Board of Health. They hired me. They can fire me. I have a contract with them. I'm a contract employee, just like anybody is an employee of any entity that's governed by a board. The CEO of that entity reports to that board, gets hired and fired. If I don't perform, I get fired. I'm not a politician. I don't get elected. The Fair Board, because it is a public entity, the Fair Board is appointed by elected individuals. All of the township trustees, the village and city mayors, and so forth, make up a body called the Health District Advisory Council. Those folks are elected, and that's the connection between the people and the Board of Health. It's set up that way for a reason, and county boards of health in Ohio were set up 100 years ago in response to the pandemic of 1918, ironically, precisely for the purpose of sharing information with people that's not tied to politics. And that's why we are connected. Obviously, if the elected individuals want to terminate the appointments of the Board of Health and put people on the Board of Health that want to fire me, they can do that. So there is that remedy. The reason that it's separated is because most of what we do when we share information, you don't need to tell people to do the things they're doing anyway. So when we give folks information or say, hey, smoking's bad for you, or drinking too much bad for you, but they want to smoke or they want to drink, whatever, it's going to be unpopular, right? That's why if health commissioners like myself were elected, you'd never have anybody remain in office, and you'd only have fools running for office, okay, because of that. it's not, it's not a real fun job most of the time, so you wouldn't get folks running for it. So consequently, most of the information we share is information that runs contrary to what folks want to do. Okay? And so there's that pushback. The fact that there is an alignment of strategy does not mean that we are working at the behest of the governor. I mean, it's not an administration that, well, I mean, to be perfectly frank, it's not an administration I elected, right? I mean, I don't have any allegiance to the governor. He's our governor, right? Okay, it is what it is. The fact that the strategies align is actually a bright byproduct of the fact that both the state strategy and our strategy locally are founded in fundamental principles of epidemiology and public health, on disease transmission, on biomedical models, on germ theory, on things that we've been doing for a very, very long time. And the fact that they're aligned really shouldn't be a bad thing, but it also shouldn't be conflated with the idea that we're doing what we're doing because they're doing what they're doing.
Yeah. Thank you very much,
Yeah,
Tom.
thanks, Tom, for
Appreciate
coming in.
Yeah, appreciate
Yeah.
that. Everybody, thank you. Okay, sorry, everybody, but I think that was, had to be done, and it was informative at the same time, so. We have the engineer's office here this morning also, some easements.
Hey, how are you?
Hey, guys.
Good.
How are ya?
We've got, catching up from
Yeah.
the shutdown and everything.
Yep,
But,
yep.
We've got highway easements for Bunnysport Road, culvert extension, Gateway Guardrail, Haskins Road Bridge, which is a bridge project, again, to Gateway Guardrail. Easy to get outside the right of way. That's what we need to do. Two for Valentine Road Bridge project as well, to extend outside the right of way and Gateway Guardrail.
Yep.
Save money for all of us.
Very good. Could we have a motion on 8, 9, 10?
7, 8.
Or 7, 8, 9, 10, sorry.
Second.
Commissioner DeWark?
Yes.
Commissioner Spiller?
Aye.
Commissioner Lance?
Yep.
Thank you, gentlemen.
You bet. Hey.
Have a good day.
Okay, I'll probate juvenile court is requesting the board approve and authorize the president of the board to execute the retention agreement with Rochel and Anders for legal representation of Geauga County probate juvenile judge Timothy Grandel in the amount not to exceed $10,000 unless prior approval by the board of commissioners. If we could get a motion to approve.
Second.
Commissioner DeWark?
Yes.
Commissioner Spiller?
Aye.
Commissioner Lance?
Aye. And then recorder's office. Do you have a request? How are you
Hey,
today?
Celeste.
I'm good, how are you guys?
Excellent.
Yeah, I'm here just to request permission to advertise for a request for proposal for our computer system.
Okay. Well, which one was this? This is the, is this the?
Our
Sure.
current vendor is Fiddler.
Oh, right. Yep, yep.
It's our vendor that we use for ours. It's a specialized computer software program.
Now, is this one Sharon's been happy with, and, or she's looking for?
We are very happy with
Yeah.
our current vendor, but we are approaching, I guess, the bid threshold of the cost, so it's just best that we do this.
Okay. Very good, okay.
Make that motion.
Yep.
Second.
Commissioner DeWark?
Yes.
Commissioner Spiller?
Aye.
Commissioner Lance?
Yep. All right.
Thank you.
Thanks for
Thank you.
coming. Maintenance. We are
Who's
going.
buying lunch today?
I think there's.
We heard you were.
I think there's a birthday party today or something.
Oh, yeah?
Yeah.
This is the, as you guys know, Richard Newsom, the operations manager for the county maintenance department, is retiring after 12 years. This is Richard Newsom. I know you guys don't get to see him ever, really. He's behind the scene, makes us look good, and then stands out front when all shit hits the fan with us, and he gets it done behind the scenes. So, like I said before, he's been very, great to the county. He's always about the county. He lives in the county. For those that know him, it's one of those things where even me, looking at it first and seeing the people he knew, I was like, oh, heck no, I'm not hiring this guy. After talking to some folks, that it was probably the best choice besides my marriage, of hiring him. So he has really, you get up to this position and you're supposed to train all the people below you. I have to say, I've learned a lot from him. He's taught a lot to our folks, our staff, so.
Well, I want to say that, Rich, thanks for 12 years of service to Geauga County. Really appreciate it. I know Rich personally is a very humble person, and I know he doesn't like this fanfare. He'd rather do the work and not be seen. And, but again, Rich is one of the humblest people I know. I really appreciate all the hard work.
Thank you. Yeah, thank you.
Appreciate it.
I think the sheriff wanted to say something.
I just know that anytime you was a job, we could always count on Rich giving it his all to try to solve those problems. And like Commissioner DeWark said, behind the scenes, quiet guy, but you always knew he was there to have your back and try to make Glenn look good. I had to talk about
Full-time
that. Thank you.
He is really truly behind the scenes. I mean, I was holding him back from pulling the fire alarm out in the lobby while you guys were in here for the last 3 hours talking to the health department. So he didn't have to come in here, so.
We haven't had a fire drill for a while.
You miss it. It's a couple weeks ago.
Well,
Tremendous guy.
but we will let you have the honors here, Glenn. since-
Oh, I'll let you read it. I'll
Well,
start tearing
okay.
up and everything.
Okay.
And
So, the resolution honor Richard Newsom on the occasion of his retirement and dedicated service of 12 years to Geauga County. Whereas on August 21st, 2020, Richard Newsom will retire from county employment from his position as operations manager after 12 years of dedicated and outstanding service to Geauga County. And whereas Richard, in retirement, plans to travel the United States with his wife, Donna, and in the spring, he can be found volunteering with Rotary Club of Burton and Middlefield at their annual pancake breakfast fundraiser. And whereas Richard started his career with Geauga County when he was hired in 2008 as maintenance supervisor, and in 2009 was promoted to operations manager. Over the years, he has demonstrated exemplary leadership, initiative, and helpfulness in the elected officials, employees, and citizens. And whereas Richard is, in his time with maintenance department, used his management expertise to initiate savings for Geauga County by creating a dedicated project team, implementing the facility dude work and order program. And in addition, he has been able to improve relationships and communication between the maintenance department and other county agencies. And whereas Richard Newsom is a treasure that will be greatly missed by many people he served, elected officials, employees, and contractors alike. And now therefore be it resolved that Geauga County Board of Commissioners honor Richard Newsom for his many achievements and appreciation for his 12 years of service and dedication to Geauga County and its residents. Be it further resolved that this resolution becomes part of the permanent record of the Board of Commissioners of Geauga County, Ohio. I'll tell you, you make me feel like an underachiever reading this.
And his wife,
Yes.
Donna, is here with him today, too.
Wow. Well, if we could have a motion, please.
So moved.
Second.
Commissioner DeWark?
Yes.
Commissioner Spillier?
Aye.
Commissioner Lund?
All right. And Glenn, if you'd like to present this to Richard, we could get a quick picture.
Thanks, boss. Okay.
Take a quick picture. That's fine, why don't you move it right in here in the middle?
All right.
Yep. There, Glenn, get in here. Yeah.
Which one will I sting
Here's
by?
Skinner right here.
Oh.
Boss man.
Both sides.
Boss man. All right, real good. Okay, hey, congratulations.
Thank you very much.
Enjoy your retirement.
Yes, thank you.
Thank you, sir.
Thank you.
So transit, we've already done that.
Yes,
Yeah.
so we're gonna move back to number 5, which was archives. They were
Okay.
switched.
Is there anyone here from archives?
This is just their contract with the company that they use to take the scans that they do and put them on microfilm so that they can be looked at.
Okay.
And stored.
All right, motion please.
So moved.
Second.
Commissioner Warren.
Yes.
Commissioner Blair. Commissioner Lynch.
Yes. All right, and then, so we're back to
Number 15.
15. The Commissioner's Office requesting the Board appoint Jim Dvorak, alternate Jerry Morgan, as voting representative for Geauga County at the SEBCO annual meeting to be held Friday, August 28, 2020.
So moved.
Second.
Commissioner Warren.
Yes.
Commissioner Blair. Commissioner Lynch.
Aye. And the Commissioner's Office requesting the Board move into executive session to discuss the discipline of a public employee at the Department of Aging. Motion, please. And we'd also, we'll have Jerry Morgan and
Jessica and Kathy.
Jessica and Kathy. Okay.
So moved.
Second.
Commissioner Warren.
Yes.
Commissioner Blair.
Aye.
Commissioner Lynch.
Aye. There now, hit that real quick. Okay. All right, be back.
No, they're coming.
Just continue.
They're going to executive session.